Hello, and thanks for joining me for a quick presentation on mass casualty incidents. So I had the pleasure of participating in a mock disaster put on by the College of Osteopathic Medicine in collaboration with an organization called WADM here at the University of New England. And I'd like to just go over some of the things that I experienced and some of the training that I was privileged to receive. So in this, we'll define what a mass casualty incident is, who the organization WADM is, how to triage an MCI, the different mock disasters that I was participated in, the life of a flight nurse, and at the end I just included a bunch of links for training, so I highly recommend clicking on those if you're interested in more of this. There's a lot of different training around the world, some actually really fun wilderness events that I would love to participate in the future. So let's get off at what is a mass casualty incident. The word mass, I would just assume that it's going to be a lot of people, like hundreds, thousands, but that's not actually the case. A mass casualty incident, an MCI, is when the number of patients outweighs the number of resources. So this could be like, here I've listed car accidents. Say you're driving down the road, you're an off-duty nurse. There's 2 people that are injured in a car accident. You being the resource, you're 1 and you have 2 patients. The patients outnumber the resources. So there you go. That is an MCI on a small scale. And then they could be much larger. When you see natural disasters like tsunamis, earthquakes, volcanoes, anything you could possibly imagine, those things do happen, as well as things like mass shootings that we're all too familiar with here in the US. Things like fires, living in the city. We see apartment buildings go up, and these are MCIs that really need medical attention, triage, and is a huge influx and a weight on the people that will be providing the care. There's even rare things like ski lift malfunctions. So there's something that happens with a ski lift where they can start running backwards, and you could have hundreds of people on a ski lift, and if that starts running backwards down a mountain, you could imagine it's pretty disastrous, and there are some major trauma caused to individuals, and they'll need some care. And the mountains, they're in remote locations, so limited resources there. So here we get into WADM, the World Association for Disaster and Emergency Medicine. They're a global organization. They provide training and resources around the world. They are an important organization because this training is very important. These disasters and these MCIs happen. We will see them, we will experience them. They're a common thing throughout the world, and it is best to be prepared because you could be on your day off, you could be traveling, you could find yourself in an incident where you're going to experience this. So yeah, I would suggest checking them out. Their link is at the end of the document. You can flip through a lot of their resources. And part of that is the triage. So when you triage people, which the CDC and FEMA, they have great resources explaining how to rapidly go through this, because sometimes you have 100 people who, some of them need acute care. They need immediate attention. They are critical. And you can use the START approach, which I'll talk about in the next slide, on how to navigate that. And with pediatrics, there are some subtle differences that we can discuss as well. So with the START, simple triage. So we're going through and we're tagging people. Literally, we have tape. We have to go through and either deem them as green, yellow, red, or black. Black, as you can see here, is deceased. When you go up to a patient, you're gonna talk to them, you're gonna assess them, you're gonna say, hello, can you tell me your name? Assess their mental status, see if they can follow commands, see if they can get up. If they can get up and they can walk and they don't have any severe bleeding, abdominal bruising, they're green. You know, if you have 100 people to go to, the point of this triage is to save as many lives as possible. So you need to go through, give rapid assessments, and then we're going to follow back through and relive these assessments. So when you go through and you find somebody who you give them their head tilt, they don't breathe, you don't see any respirations, not even in the slightest, unfortunately you have to tag them with the black tag and you move on, because there's other people who need your attention, and if you don't give that to them, they'll be tagged black as well. You know, the people who have the red tags, they need immediate attention. So you're going to go through, you're going to put that red tag on them, and when you get more support, they're going to be the first ones. They're going to be the ones that get the attention. They're going to be the ones that get put in the ambulance first, as opposed to the yellow people who are, you're like, they're stable now, but they could rapidly decline. You know, they're good now, but let's follow up on them in a little bit. Red tags get the attention at the moment. And when you get to the pediatric part of things, you really need to go through the mental status. You need to see if they're alert. They can't get up and walk. You got to assess their developmental age. You need to see what abilities they have. If you have a 6-month-old, you need to see if they're crying. If they're crying, amazing. They're breathing, they're active, they're alert. If they're not responding to things, you need to put a red tag on them. If, unfortunately, there's no respirations, there's no pulse, they're apneic, and you're giving them rescue breaths, but they're still apneic, unfortunately, and it's a very difficult thing with the children, you have to put a black tag on them and move on, because, again, you're trying to save as many lives as possible. So in the following slides, they're all mannequins. There were a lot of actors that were in full makeup, a lot of fake blood, a lot of fake injuries, and they all had little bios, and you could talk to them and do these triage assessments on there. I didn't include any of their videos because I did not have their direct permission, but there are a lot of mannequins, and these are some traumatic scenes that we can and we will experience in life. So the first one was an earthquake with a pediatric scenario. So we had to go through and find these babies behind trees. You would hear crying from a distance. You'd find a baby under a tree branch. You would have to give these, be like, are they apneic? Can they breathe? Do they have perfusion? There's no pulse. And quickly tagging them, and then we'd be rated on how we tag them. So that was a really interesting way to go through a pediatric earthquake scenario. Next, we had a wilderness scenario. So say you're remote and you're walking through the woods and a squall comes through. Boom, thunder and lightning. You're on like Half Dome in Yosemite or something, which actually did just recently happen. There were some hikers up at the top of Half Dome and they had to hide out in a cave. They suffered minor injuries. They were lucky to go through that, but these things happen. And when a lightning burst happens, you think about, wow, somebody's going to have severe burns. They're going to have cardiac arrest if they're directly struck by that lightning bolt. They are going to need attention. They could very well be tagged black. You have people who are near there who, with a loud thunder boom and the crack of that lightning, have lost their hearing, are completely dazed. They are in a panic, and you can't tell what their status is. So you need to put a red tag on them because you're like not able to give them a full assessment. You need to calm them down and you need to figure it out. But if they're standing and they're moving around, they might require a green tag depending on how many people you have in that scenario. So it's really interesting because, again, limited resources. You're out in the wilderness. And so we got on to the main event was the mass shooting where the shooter had been neutralized and the police gave us the safe pass to go. There were smoke bombs, there was noise, and there was about 100 victims scattered around. As you can see, most of these victims were not shot. There were so many injuries caused by panic, run over by vehicles, people with missing legs, just everything, and you just really needed to go through and assess and triage these people. Various conditions, very sad, very bloody, very gory scene, difficult. Another difficult part is during an active shooter, people are fleeing, people are hiding, people are in bushes, people are around corners, people are unconscious. You need to turn over all the rocks, you need to look for people, and you need to find them quickly. And what you do after this is you make a makeshift field hospital where you're putting all the red tags over there and possibly the yellow tags, green off to the side, keep them out of the way, keep them calm. This is where you reassess. Have the red tags turned into yellow tags? How have the yellow tags done? Have they declined rapidly? Who is going in the limited number of ambulances that are arriving to the scene? You really need to reassess all of those people. And when it comes to life flight, these helicopters get people to the resources they need, and they get to the people who need resources. Remote locations get you to the hospital, like Maine Med is a critical care center. People 100 miles away can get to Maine Med super quick in a life flight helicopter. These people are highly trained. The flight nurses in there have the capability to put IV fluids, to give medication. They don't need prescriptions. They don't need a provider order. They go through serious training. The nurse that gave us a lecture, she even talked about how she had to go down to Maryland, get put in, a number of them get put in a crate. It gets a giant box that acts like the hull of a helicopter, flipped upside down, thrown in a pool, and they have to figure out how to get out of that. The training for this was extensive and very, very impressive. And so with the training seminars, we learned about the flight nursing and everything that people had to do to become a flight nurse, and it was so impressive. I highly recommend checking the link at the end of this presentation to see what that entails. And so some of the other presentations that we got to do and the lab skills, we got to do field intubation, which I don't have any pictures of that because it was so hands-on, but learning how to intubate people. And then we learned how to insert a chest tube. This is more for providers, more on the osteopathic side of things. We use, as you can see here, these are pork ribs, how to make an incision, how to stay at the top of, how to find the rib and go right above it and in and just get that airway to people. The effects of rhabdomyolysis, compartment syndrome, when somebody gets a crushed extremity, the rhabdomyolysis happens so quick, there's going to be severe damage. You need to attend to it. Same with Stop the Bleed. We learned how to pack wounds. We learned how to put tourniquets on and just do so many amazing, amazing things. And I think it's valuable training that I look forward to reliving and redoing. And here are the links, to WADM, the CDC, FEMA, Life Flight Maine, and then this wilderness maining that has training all around the world. They seem like amazing retreats. So I would recommend going in and checking out those if you're interested in MCIs and triage and learning more about wilderness medicine and just how to treat people when resources are limited. And lastly, I just want to give a special thanks to the UNE College of Osteopathic Medicine and WADM for putting that on. I was in direct communication with Braden Allward and Jared Erb. They're here at the University of New England. They were great organizers and put the event together quite well. It was just an amazing experience. And, like I said, we are going to experience these things. This happened 1 week before the Lewiston shooting. And it was just, it hit home where it was, wow, I just learned about this. I see the importance. And then it was very close to home. And I highly recommend becoming versed and well-trained in these areas. Thank you for listening. Bye-bye.